Welcome to Indian Anatomist. FMGE, NEET, Next 2024. PG Exclusive Test Series. Hello, medical professionals. Warm greetings to you all. Today, we are going to discuss a multiple choice question from embryology. Which of the following is a condition in which the meninges, together with spinal tissue and CSF, protrude as a result of neural tube defect, that is NTD? The options given are A. Spina bifida occulta, B. Meningocele, C. Meningomyelocele, D. Myelocele, E. Encephalocele. Before choosing the best path, one must first educate themselves on the topic. What exactly is a neural tube? How does it come into being? Where does it get its start? And what are the abnormalities that were present at birth? Neural tube is an early embryonic component of the CNS, which includes the brain and spinal cord. There are three germ cell layers involved in CNS development: ectoderm, endoderm, and mesoderm. Important among these is the ectoderm, which is the outermost layer of the embryonic disc. Now, the embryonic ectoderm is further divided into two. They are 1. Surface ectoderm, differentiates into the epidermis, nails, and hairs. And number 2 is neuroectoderm, that gives rise to the neural tube and neural crest cells, that subsequently give rise to brain, spinal cord, and peripheral nerves. During the initial weeks of embryonic development, the neurulation occurs. Now, what is neurulation? The formation of the neural tube is called neurulation. During the third week of development, the neurogenic growth factors, that is, noggin, chordin and fibroblast growth factor 8, are released from the notochord in the mesoderm. This makes the ectoderm above it turn into neuroectoderm, which thickens at the dorsal midline, and is called the neural plate. Later, the neural fold or groove are made, when the edges of the neural plate curve inward, eventually transforming the neural plate into a tube. The progenitor cells of the neural tube are known as neural precursor cells. Before the neural tube is fully formed, a group of specialized cells called neural crest cells form at the junction of surface ectoderm and neuroectoderm. These cells are later differentiates into melanocytes, craniofacial cartilage and bone, smooth muscle, peripheral and enteric neurons, and glial cells. During third to fourth week of intrauterine line, the neural folds move towards each other, and meet in the dorsal midline to form the neural tube, which is the precursor to the brain and spinal cord. This is called the primary neurulation. After formation, the neural tube's caudal end will go through a series of steps that will result in it being hollow, the canalization. This forms the definitive neural canal, and this process called secondary neurulation. Now, this primitive neural canal has openings at the cranial and caudal region, are called cranial or anterior neuropore and caudal or posterior neuropore. Around the 25th day of IUL, the cranial neuropore closes, and the caudal neuropore closes on the 27th day of IUL. Until the closure, the neural tube connects with surrounding amniotic cavity through neuropores. We understood that the neural tube is formed with two openings, that is cranial and caudal neuropores. Further, what happened? If the cranial and caudal neuropores don't close, the embryo or fetus will have neural tube defects, that is, NTDs, which may last for the rest of the pregnancy, and even after birth. These problems happen very early in a pregnancy. Folate or folic acid shortage before and during pregnancy is linked to NTDs. In humans, the incidence of NTDs is 1 to 5 in 1,000 live births. But the worldwide occurrence of NTD births has decreased over the past few decades, as a result of therapeutic termination of the pregnancies, and widespread use of ultrasound screening, as part of routine prenatal care. Additionally, primary prevention efforts have been undertaken through the provision of folate or folic acid supplementation during the early stages of pregnancy. The non-closure of the cranial neuropore is the underlying cause of the neural tube malformations, known as anencephaly, encephalocele, and anencephaly. During embryonic development, anencephaly develops when the scalp, skull, and brain are missing. It is a cephalic condition, caused by a neural tube defect in which the cranial neuropore of the neural tube fails to close between the 23rd to 26th day after conception. Encephalocele is a neural tube defect, in which the brain and its coverings, the meninges, protrude through holes in the cranium like a sac. The neural tube does not close completely, while the infant is still in the womb, causing these issues. Depending on its location, encephalocele can range from mild to severe. Now coming to anencephaly, it is a rare cephalic condition, is characterized by a deficiency in the occipital bone, spina bifida of the cervical vertebrae, and retroflexion or rear bending of the head on the cervical spine. The most common consequence is stillbirth, followed by death. The caudal end of neural tube may show anomalies called spina bifida. Spina bifida is a birth defect, caused by the non-closure of caudal neuropore during the fetal development, however a closed tube may reopen in some situations. It is also called a split spine defect. It's further classified into spinal bifida occulta, myelocele, meningocele, and myelomeningocele. What is spina bifida occulta? Spina bifida occulta is the less severe form of the spina bifida. It is also called as closed spina bifida. The newborn with this NTD will have a tiny dimple in their back. One of the typical sign of spina bifida occulta is presence of tuft of hairs around the dimple. They are asymptomatic or suffer no impairment because their nerves and spinal cord are unharmed. Usually the lumbar and sacral vertebrae are bifid around the neural tube. The next is myelocele. Myelocele is a condition in which the spinal cord is exposed, leaving the nerve tissue on the surface of the vertebral back uncovered. Also called as myeloschisis. There is no covering of any kind, not even the skin or the meninges, the membranes that enclose the brain and spinal cord. Upcoming explanation talks about meningocele. The meningocele is a type of spina bifida that is characterized from other types by the existence of a fluid-filled sac that protrudes through an orifice in the back of the newborn. Despite this, the spinal cord is not damaged in any way, and is unaffected by the condition. At last, what is myelomeningocele? Non-closure of caudal neuropore of neural tube results in myelomeningocele. It is also known as open spina bifida, which causes a fluid-filled sac to protrude from the back of a newborn. CSF, meninges, nerves, and a segment of the spinal cord are all located within the sac. It's the worst and most common kind of spina bifida. With these explanations about the non-closure of cranial and caudal neuropore, let we see the questions and its options again. Which of the following is a condition in which the meninges, together with spinal tissue and CSF, protrude as a result of neural tube defect? The options are A. Spina bifida occulta, B. Meningocele, C. Meningomyelocele, D. Myelocele, and E. Encephalocele. Now the correct option is C. The meningomyelocele. Here, meningo means meninges, myelo means spinal cord, and cele means sac or cavity. Today's clinical question is completed. Hope you all enjoyed. We'll meet you again in another clinically oriented multiple choice question. Thanks for watching. Good day all.